everybody, welcome to Health Matters. My name is Ryan O'Connor. These are proudly brought to you by Cipla. Now, have you ever had this feeling where your body's just had enough? It goes handbrake, and it goes into full-blown protest mode. And of course, it sets off this wave of inflammation that never stops. Well, the good news is if you are kind of one of the thousands of South Africans that find yourself battling with chronic inflammation, this episode of Health Matters is just for you. It's going to help you understand how NAD plus levels might hold the key to calming those fiery immune responses. And to tell us more, we welcome back Dr. Adrian Wentzel, Specialist Anaesthesiologist at St. George's Hospital. Of course, he's also part of the Medical Forum Theatres in Port Elizabeth, South Africa. Dr. Wentzel, it's so lovely having you back on this podcast. What is NAD plus and what is its role in the body?
Thanks, Ryan. Thanks for having me again. It's been a little while. NAD plus, easy to say those terms. Nicotinamide adenine dinucleotide. It's a hell of a mouthful. Basically, what it is a cofactor that we find in energy production. It sits in the Krebs cycle, integral part of it, so that we can make energy in the mitochondria. And basically, it allows us to utilize oxygen to make this energy. It's also a cofactor in about 400 different other different enzyme reactions, mainly in the auspices of electron transfer. It's utilized massively for SIRT1, which is like the engine controller. It controls inflammation. It controls a lot of things, and then it's used for repair of DNA by PARPs or poly-ADP ribose polymerase. And it's also used to break down alcohol for those guys that like a few pots in the evening. And then it's basically utilized and consumed by CD38 positive immune cells, especially in inflammation. So really, that's sort of a nutshell of what we're looking at.
Okay, because the next question was going to be, how does NAD plus relate to chronic inflammation?
Well, I think we know, and the literature is very clear, that as we age, our NAD goes down, and we're not sure about why this is, but it's most likely related to oxidative stress. As we're getting older, our cells get older and they need to be repaired more. And basically, with the increase in oxidative stress, we need to use more NAD to repair the DNA that is actually damaged. The NAD, along with zinc, is used by a thing called SIRT1, and SIRT1 basically is a cofactor. NAD and zinc are both cofactors for the SIRT1, and SIRT1 is a downregulator of inflammation as such. It also has many other controlling functions, but basically decreases the interleukin 1 and 6, and thereby decreasing tumor necrosis factor alpha, which is very positive for inflammation. So really, we have those things that consume it, like SIRT1, and then those things that allow us to increase it by basically supplementation and the natural products.
Okay, what is the difference, Doc, between acute inflammation and chronic inflammation, and how can the average person recognize those differences?
Well, I think the main thing is that first to say that inflammation is very important in the body. It allows us to protect ourselves. Acute inflammation really is of shorter duration. It's limited. It's normally when the body has an infection or there's something that has happened, an injury. The acute inflammation basically can easily be identified. It's red, it's inflamed, swollen, and you can often find that it's quite puffy. It's normally localized, and really it's there to repair and supply immunity if it's infection. And when one has acute inflammation, normally, in most circumstances, you have a balanced anti-inflammatory response in other areas. Whereas chronic inflammation, it's obviously a longer protracted type of a situation, but not always. And often there's no observable insult to the it's often associated with other disease processes, inflammatory diagnoses like type 2 diabetes, obesity, thyroid disease, things like irritable inflammatory bowel disease, stress, and things like Crohn's disease. And the way that it doesn't always have to be associated with an inflammatory disease, but when we're actually looking for it, we're looking sort of the signs of things like fatigue, anxiety and sleep problems, muscle pain, and they also go hand in hand with stress, bowel issues. And really, these are all related to NAD dependence for SIRT1. SIRT1 is allowing this inflammation to proceed.
Doctor, what's quite important here is that I guess the big question, and this would ultimately be the one that people would want to know, is after all of this, is it possible to increase or boost our NAD plus levels in the body? What options do we, listening to this podcast, have?
Yeah, I think the most important thing, first of all, is to realize that there's normally a trigger, inflammation, and then what we do is we get a consuming type of a situation where the NAD is utilized by things like SIRT1, managing the inflammatory response, and then as well as polypops that are trying to repair, also consuming. And basically, this deficient state allows us to sort of look at how we're going to manage it. I think, first of all, we need to try and look at preventing a low NAD state. So things like a balanced, healthy diet, limit high GI foods, utilization of some polyphenols, and you can get them naturally in things like berries and grapes and nuts. Reduction in stress. Stress is a big driver of inflammation. And then moderate exercise. And you notice that I say moderate exercise because sort of literature is coming to show that severe exercise can induce injury. And that, again, can be the source of inflammation as such. And from what the current literature is saying, sort of less than 8 hours a week, and it can be that sort of keeps you safe. So really limiting damage, management of sleep. And then stopping smoking if you're a vapor or a smoker. I think that decreases oxidative stress at a lung level as well, and generally. Then I think it's quite important that we can offer supplementation. There are many very varied ones. The ones that I'm interested in is nicotinic acid. It utilizes a different pathway to the other 3 or 4. Uses the price handler pathway for its precursors. And we're starting to see that these precursors seem to feed the microbiome in the gut, and it prevents leakiness. And we think this is through this receptor that it works directly on, called the GPR109A receptor. It also, we're hoping with the nicotinic acid to downregulate the kynurenine pathway, which we know is changing the immune response, possibly in a negative way in some of the chronic inflammation states. And then I think then we can look at managing CD38, trying to decrease the amount that it utilizes NAD. So we can add in a few other things other than just the nicotinic acid that are like, and if there wasn't inflammation before, then I would say that you can use any of the NAD plus precursors. Adding in things like zinc to assist with the cofactor for SIRT1, bioflavonoids like resveratrol and quercetin have real value, and then other Bs. We mustn't forget about the B6s and the B12s. B12 very much association with depression and anxiety. And then one can look at the vitamin C, which is a good antioxidant. And then the third thing I think that the consumer can do is you got to exclude chronic inflammatory conditions and treat these if possible. We need to be managing weight and trying to decrease any obesity, manage the diabetes appropriately, look at cardiovascular disease, the risk to the heart and for strokes in the brain, and then chronic infections like hepatitis, manage these autoimmune diseases. And then we need to really limit our exposure to things like irritants and other things that might cause our NAD to be low, as well as increasing the inflammatory response.
This is incredible. Again, extremely insightful. I think that for most of us that have any kind of inflammation, whether it's chronic or other, it's quite insightful as to how the body responds, what the response is like, and of course, what is needed in the case of many. So, Doctor, again, thanks for your amazing time and insightfulness on how NAD plus levels holds the key to calming those fiery immune responses. Very insightful once again. And often, it's quite interesting that inflammation isn't picked up. We often associate in layman's terms inflammation with when you twist an ankle over on a sporting field, or you have some kind of response to an injury, and often it's often hidden from us.
I think with chronic inflammation, the big thing is to realize that inflammation breeds inflammation.
Yes.
If you have chronic inflammation, then basically what you do is you're consuming your NAD, you're decreasing the amount of SIRT1, and allowing more inflammatory cytokines to be present. They drive further inflammation, which drives the circle round and round. And the only real way that I can see is to look at these 3 levels of management: the things that are using NAD, those that are consuming NAD, and then the ability to limit that and make more NAD, which I think is very possible.
Love that. Absolutely love that. Ladies and gents, like, subscribe, give us the thumbs up. A huge thanks to Dr. Adrian Wentzel. Doc, thanks for your time again. Looking forward to chatting to you again in the future.
Awesome. Thanks very much for the invite.
Thank you so much. Like, subscribe, be a part of the community at Health Matters, proudly brought to you by Cipla.